Pals podcast, where the proof is in the pudding, and this pudding is thick.
Or sliced.
Sliced. It's sliced today. I got sliced.
You did get sliced. Let's hear about it.
I got sliced. Danielle took me to get my upper bleph. It's an upper eyelid surgery, and I've been really hesitant my whole life to ever get anything cut because I'm a chicken shit.
You also don't like to be put to sleep.
I don't like to be put to sleep. And this procedure, I was able to be awake for. A little something to relax me, and I was good to go. It was honestly easy. I healed great. I look so much more awake, so I'm so thankful. I don't feel heavy eyelids anymore.
Yeah, your eyes do look amazing. What has it been? It's been 2 months?
It's been 2 months, and they healed great.
Did Danielle take you because Scott didn't agree?
Scott really believes in aging gracefully, Ash, but
That's why we see all those grays.
I will tell you something. He does say he sees a big difference now.
It looks great.
So I think he's not so against it anymore. You know, you got to do what makes you feel good.
I agree.
Yeah.
So
You took it like a champ. You did pretty well.
I did take that like a champ. Little to no painkillers after, and never again.
You just came over with ice all over your face all day.
I iced a lot.
And
I definitely recommend
you
icing.
pretty quickly, I feel like.
Icing and arnica.
Yeah, that's great.
You did. All right, well, today on the couch, we have Jordyn, myself, Danielle, Ashley.
Hi.
Today, we actually have on my plastic surgeon, also our good friend, Dr. Matt Hershcovitch. He is an ENT and a facial plastic surgeon, and we are so happy to have him here today.
Let's bring him in.
Let's do it.
Welcome to the Pudding Pals podcast.
Dr. Matt Hershcovitch, welcome to the Pudding Pals podcast. We're so excited to have you here, Matt. You're our friend, our doctor, and I know everyone's got a lot of questions for you. So before we start, go ahead. What are you going to say?
Oh, I'm your go-to when one of your boys gets a laceration.
Slice them on the...
You're our go-to with everything, legitimately. You know, for anyone who hasn't met you yet, can you tell them what kind of medicine you practice?
Sure. So I'm a physician here in Southern California, and I do both otolaryngology or ear, nose, and throat, as well as facial plastic and reconstructive surgery. I'm actually double boarded in each of those, and so it's quite the glutton for punishment during my education and training.
Yeah, it's absolutely incredible. I think because we just showed a bit of my day of...
The journey to your office for the upper bleph.
Her nip and tuck.
We just showed a little bit of that in our intro. And so I think we're going to get right into the bleph because obviously, you know, we have had so much hype after, you know, showing that I got the bleph and being honest about it. So many questions and so much interest. So a big positive for me about doing the bleph was being able to be awake. And can you tell a little bit to our listeners just what the procedure entails and really how quick and easy it was?
Sure. So an upper blepharoplasty, very simply, is just removal of some of the excess skin of the upper eyelids. Unfortunately, that is one area as we age. That's a lot, and many people, one of the first to show, call it signs of aging, where you actually start to look old. You look tired. You look like you haven't slept. Even if you have, it looks like you haven't slept. So what the surgery is, it's pretty quick. It's pretty easy. We use a little bit of numbing medicine on the upper eyelid. It's, you know, it is a little shot, but frankly, if you've had Botox before or filler is probably a lot worse to get. Oh, 100%, 100%. And then once you're numb, you don't feel anything. And you can actually get real-time feedback from the patients, have them open and close their eyes, see where, you may or may not need to remove any more skin. And it's a lot safer too, because you're not putting them to sleep with the general anesthetic. So it's quite a nice way to do it. Recovery and pain afterwards is minimal. Most people do really well with, just Tylenol or something after. And, then afterwards you have stitches in, they come out after 1 week, and then you look great.
I mean, Matt, Jordyn's looks unbelievable.
I am
Like, unbelievable.
Her eyes are now open.
Yeah, my eyes are open.
I know.
What do you attribute, I'm 41. Is that average age to be getting an eye bleph? What do you attribute to my skin starting to fall so fast to?
Well, so genetics definitely plays a very strong role in that, and some people just have heavier lids. For the most part, 40s is not uncommon to have this done. I've actually had a few people who've had it done in their 20s, but I would say the average is probably late 40s, early 50s.
All right, Matt. Well, talking about anti-aging, let's talk about facelifts.
Yes.
Yes.
That's next.
What age should we start to consider? Because
Shit's falling down already.
I feel like I'm already,
My turkey neck.
gravity is pulling me down.
And what can you do to prevent it from falling down?
Right. So age is just a number. It really depends, as how much laxity you have. I mean, some people, for various reasons, which I'm sure we'll probably get into, age faster than others. The facelift, basically what it does is you lift up the skin on the side of the face here and on the upper neck, and then you lift and tighten the musculature underneath. So then that is secured, and that's what actually gives the structure to the face. And you reposition the fat pads in the face. It sounds bad to have fat in the face, but actually it provides a more youthful look. You reposition them to a more higher youthful location. And then you lay the skin back down and you close it all up after trimming the excess skin. Um, when it's different for everybody. Now I will say the younger people are much more inclined, and frankly, it's much more appropriate to be doing a mini lift for younger people.
What's the difference of them all?
Right. So a mini lift can actually be done like the blepharoplasties in the office under local anesthesia.
So you're
Sign
awake?
me up.
You're awake. Yeah.
Oh,
You're
God.
awake for it.
Can you smell it?
It's not bad otherwise in terms of pain. The difference is what you're doing is you're lifting what's called the SMAS layer, or that's an acronym for superficial muscular aponeurotic system, and you actually can tighten that layer.
Say that 10 times fast.
It's a little different because than a deep plane facelift, where you actually go underneath the SMAS layer and you can actually access some of those fat pads and tighten those directly. So a deep plane or full facelift is better when you have more extensive laxity, more extensive jowling, and in general, those people are going to be on the older side. So I would say 40s and 50s for the minis, and then you're probably looking at 60s for the deep plane.
How long does it last? Like, do you have to do it again?
Well, what I tell my patients is, look, you're just turning back the clock to kind of how you looked ideally about 10 years ago. And
What if you want to do like 20?
yeah,
I'm
I mean,
70,
it's
I'd do like 50.
it does do a nice job rejuvenating the face. Now, how long it lasts, it's not all of a sudden you have this completely youthful look and then 10 years goes by and it all falls. It's a gradual thing. You keep aging, even afterwards, but you're aging from a much, we'll say, earlier appearance, much younger appearance. So I would say on average, these are going to last about 10 years before you start looking like you did prior to having the facelift.
And then can you do it again?
You can do it
Yeah,
again.
my mom's had two.
So Matt, so the mini ones you pull it from the like behind the ear is what you're saying?
Yeah, you're pulling from the same area. It's just which layers are being pulled. That's really what it comes down to.
Isn't
The
that
forehead's not
the
included in
forehead's
a
for
mini
Botox?
facelift, right, Matt?
You just need
Forehead
a-
wouldn't be in the mini, but in a deep plane, you can extend everything up and do the forehead.
Okay, I
And
kind of
that
have
can
a
all,
question. What did Kris Jenner do?
she did everything.
The whole thing?
Yeah, and then some. She had a deep plane facelift. She, I think, had an endoscopic forehead lift at the same time. She also had fat transfer as well because she got some very nice cheeks going on there. So yeah, Dr. Levine did a good job, really
Yeah,
good
no,
job.
she looks great.
Yeah.
Are there any treatments, although Matt knows best that I just want this taken care of already, but are there any treatments to help us prolong the need for the mini facelift?
Yeah.
Okay. So yes, and the biggest things are you want to make sure to take good care of your skin and take good care of your body. So, as much antioxidant food, minimizing inflammation, that's really important. What's going to be necessary is also protecting yourself from the sun. The sun does enormous damage to our collagen in our face. So, wearing sunblock every day and all the ancillary treatments, the neuromodulators like Botox, Dysport, all of that, very important to maintain, we'll say, good resting tone. And fillers can be a nice adjunct to helping minimize the appearance of laxity. One thing that some of them can actually do, some of the heavier duty fillers like Voluma or Restylane Lift, they can actually really kind of lift the cheek and kind of give structure to the face again. So all those things are very helpful for putting off getting a facelift.
Yeah.
Sign me up.
Okay, and then let's talk rhinoplasties. What is the biggest misconception, and how many people do you have come in and say, I have a deviated septum, but they really just want to get their nose done?
Every single
person.
day.
But I have a
Every
deviated
single
septum and I
day.
do not have a nose
Me
job.
too.
Ask him. He told me.
I didn't have a deviated septum, and I had a nose job.
So back in the day, and this kind of predated my time practicing, but back in the day, you know, you used to be able to say you were doing a septoplasty and then just do a rhinoplasty, and you know, then the insurance started questioning why the surgery took 2 hours. Okay, and for just a septoplasty. Um, Septoplasties are often done at the same time as rhinoplasties because, well, you're there, you're opening everything up. It's pretty easy to do at the same time. But the septoplasty is primarily for breathing, and a rhinoplasty is just reshaping the outside. So, unfortunately, it's a myth that you can still get a rhinoplasty done while just getting a septoplasty. That's very much
Those
fraudulent.
days are
So,
numbered.
Yeah.
yeah.
Those days are gone. Insurance is cracking.
Oh, yeah.
They've
Oh,
caught
yeah.
on.
Oh my God.
Should we talk ENT now?
Yeah.
All right. What is the most common issue that you see in adults
In your practice.
in your practice? Yeah.
I see a ton of nasal stuff, and I think it's no accident because I also do a lot of rhinoplasties. I see lots of deviated septums, and also, and this is just purely because this is extremely common, tons of sinus and allergy issues. So Deviated septums, nasal obstruction, those are far and away my biggest complaint of when people walk in here. So that that's a very, very large portion of my practice, for
How do you
sure.
know if someone has like bad sinuses or if it's like a bad allergy?
Yeah, it's a good question. So in younger kids, you're naturally going to be significantly more conservative because a their nose, faces, and sinuses are not fully developed, and b most of the time it's actually allergies. Actual true sinus problems in children is actually quite rare. Now, in teenagers, it's a completely different story. That's when you start to develop these adult problems, of which chronic sinusitis is. Now, differentiating them from allergies is tough because a lot of times the symptoms have significant overlap: runny nose, sneezing, nasal congestion, obstruction, facial pain, pressure. All of that is very much common in both conditions. Now, the one thing is one symptom that's quite unique is itchy eyes. Itchy eyes is almost universally present in allergies, versus a chronic sinusitis is probably going to cause more on the headache, facial pain, eye pain type of situation. But itchy eyes, that's pretty typical of allergies. But to be honest, it's tough to tell. Many times, if you take like a Claritin, Allegra, Zyrtec, an antihistamine, and it helps, there's probably at the very least, an allergy component, if not entirely allergies. However, if you take it and it doesn't quite work, then you have to start suspecting that there's sinus problems going on. And to be honest, the vast majority of people, they're not mutually exclusive. You can easily have both, and
Is it
often
kind of like
do.
with kids, the eczema, allergies, asthma? So sinusitis and allergies go together. Like,
Yes, as does asthma too. We see this, yeah, because, well, if you think about it, you have respiratory mucosa in your lungs that gets inflamed in asthma. And you have a respiratory mucosa in your nose and sinuses that get inflamed during allergies and sinus problems. So they're actually quite similar in terms of their pathophysiology.
When do you tell your patients that it's time for sinus surgery? And what are your thoughts on the sinus surgery? And we hear so much about the balloon. So when is it time to take that step?
And what is the balloon?
Yeah.
Right. Okay. So there's a couple ways of managing, we'll say, someone who now carries the diagnosis of chronic sinusitis. So a lot of times when people are coming to see me, they've done the saltwater spray and rinse. They've done the topical nasal sprays, the Nasocorts, the Rhinocorts, the Flonase. They've done their antihistamines. They've usually been on antibiotics and steroids too. So, at that point, I'm not really going to reinvent the wheel, especially when they've been treating it for, many times they're coming in after years of problems. More if Flonase and saline and antihistamines didn't work the first time, it's not going to work the 50th time. So, at that point, usually I'll recommend we get some imaging done. And then, based on that, if there's inflammation and blockage, there's ways of opening things up and getting rid of that inflammation. So, there's basically two big ways to do it: there's surgery, which we call functional endoscopic sinus surgery, and then there's sinuplasty, which would be the balloon. So, that one's minimally invasive, done in the office. So the idea behind any kind of sinus procedure is to restore normal anatomy and make more room in there so you can move air. The balloon is done with inserting a camera in the nose, and you guide a little catheter into each of the openings, and then slide the balloon over the catheter and dilate it open. And that's pretty much it. And it actually gives you and restores, we call it supernormal openings to your sinus cavities. And then any medications that you then take will actually work because it's actually going to get to the area that's going to need to be, and things are going to drain nicely, things are going to ventilate, they'll flow, they'll dry out, and you're happy and healthy again. Sinus surgery does the same thing, but a little, more oomph. Yeah, a little more invasive. Then we take out some, we'll say, more aggressive instrumentation. You're put to sleep for it, and we kind of bore out and drill out the openings.
What's the difference of the recovery?
So recovery is different for each of them. Obviously, the endoscopic sinus surgery is going to be significantly longer. I mean, then you're talking about 1 to 2 weeks versus sinuplasty. It's generally going to be, we'll call it a weekend recovery, and then you're good.
Does the balloon need to come out, or does it disintegrate?
Yeah, it only is inflated for several seconds, and then it comes right out.
Oh, and then you take it out. Got it. I didn't know if it stayed in there.
Matt,
No,
you said that people have these issues like 50 times before they come to you, and it's obviously a bigger issue. So at what point would you say, come to me instead of your primary doctor? How many times of an issue?
Well, if it's your first time ever having an issue, go ahead and go to your urgent care, have your primary care treat it. Chronic sinusitis is going to affect northwards of 20% of the population, which sounds a lot of people get this at some point in their lives. So it's extremely prevalent. It's not so much the how many times it happens, but it's duration. If this is going on for more than, say, like 8 to 12 weeks, you should probably come see me. When someone says, "Oh, I've had a cold for the last 2 months," the colds don't last that long. It's something else.
Yeah. Let's talk about the soundtrack to my life, my husband snoring.
Same.
Snoring and sleep apnea. How often do you see these? And I mean, how can you help these people?
Hit him.
I do. Instead of me just saying, shut up all night.
Okay, so let's talk about snoring and sleep apnea. And I like to think that I've saved many marriages because I've helped
I know you're trying to
various
save
husbands
mine.
with their
Now they need
snoring.
a sex therapist and an ENT
Yeah.
to save your marriage.
So not all that snores has sleep apnea. We'll just start with that. Sleep apnea is different. That's where you're actually not getting enough oxygen, and you may be stopping breathing. That actually is medically dangerous and needs to be addressed because it can lead to serious health problems. Now, pretty much everyone who has sleep apnea does snore. So if you're snoring, it's something to investigate. But not everyone who snores has sleep apnea. But let's just talk about snoring. Snoring comes, we call it, it's a multi-level problem. So
First with your wife, then then the dog, then you're downstairs sleeping in the guest room. Multiple levels of problems.
If you don't get it addressed, you'll be sleeping on a different level.
Yeah, you'll
But
be sleeping on
it
another
occurs.
level.
You'll be Scott in Mason's room.
It occurs due to, sometimes it's from nasal obstruction. So you can have a deviated septum, enlarged turbinates. The next level is usually the palate. Sometimes the palate can be a little long, a little floppy, and that's what vibrates and causes a lot of that noise. Yep, that's exactly right. Sometimes it can be the tonsils, right down from the palate. And then just below that, the base of tongue. Sometimes when you're lying down, the tongue actually falls back in your throat and can cause some blockage. So all of those things would need to be looked at. Some of those are easier to fix surgically than others. The nose, nasal stuff, that's actually quite easy to fix. Palate and tonsils obviously can be fixed surgically. The base of tongue's a little tougher to deal with, but it can be dealt with. And then, of course, there's if you do indeed have sleep apnea, CPAP is also an option. And that a lot of times will help alleviate snoring.
The machine, right?
Yeah.
The machine.
So it's like they snore, you don't want them next to you. Now
But
they got the
the
machine.
machine,
That ain't sexy
uh-uh.
either. How are you saving their marriages, Matt?
Well, a lot of times when they're coming to me, they've usually tried CPAP, and for whatever reason, they don't like it. Their spouse doesn't like it. They don't like the noise of the machine. They keep taking it off and then start snoring again. Or a lot of times they don't tolerate it because they were given CPAP, but they have a huge blockage in their nose, and then they frankly can't tolerate it because the CPAP's trying to push against a blockage, so it's not actually working. So once we fix that, a lot of times it obviates even the need for CPAP.
I know a few people who have a CPAP and actually said they love it. Like they can't sleep without it.
Really?
Yeah.
Yeah,
But
actually, we have a lot of people in our family who have it.
I mean, it's not cute and it's not sexy, but like I do know people who
Wow.
have it and they love it.
Well, this
But
pudding is not
also,
having
you
that in her room.
No.
You don't have to be overweight. I think that's like a misconception. Some people think like sleep apnea is only people who are heavier.
That's 100% right. It's not, obviously if you're overweight, you're at greater risk for developing sleep apnea, but there's plenty of tall, thin men who have sleep apnea too. If they're a little bit kind of gangly, a lot of times you have we'll say like floppy cartilage, and so I mean that's definitely a possibility. Just because you're thin doesn't preclude you from snoring or having sleep apnea.
Well, the one thing I don't have or need is that my snoring is non-existent.
Yeah, me either, unless like a night of drinking or something.
Yeah.
No snoring here.
All right, Matt. So, what are some of the newer technologies or trends in facial surgery that actually live up to the hype?
What should we get?
Yeah.
So we'll start off just some basic categories. So let's talk first lasers, okay? Fractionated CO2, that's great. I mean, it really does a great job.
What does it do?
Is that the one you have to be put to sleep for?
You don't have to be put to sleep. You can do it awake, but it's you look like Satan for a week. I mean, you're burned and you are red and peeling and you just look awful.
And what does that
Yeah, what's
what does that do?
So what that does is it gets rid of a lot of the fine lines and wrinkles and gives you a full refreshed look on your face, gets rid of a lot of the melasma, dark spots. It does everything.
What about pores? Does it get rid of your pores?
Yes, it does. It does a really nice job. We actually use it medically for uh, uh, men with enlarged pores on their nose, a condition called rhinophyma, and it works quite well. So fractionated CO2, it's great. It's kind of an old school laser, but it's still nothing's been able to really top it. There's a ton of other stuff out there that's just not as good. An erbium YAG laser is probably the next level down from a CO2. It works pretty well. That's also an ablative resurfacing laser. Um, IPL is great for like sunspots, dark spots, melasma, rosacea. It's great for that. It also works well for acne too. It's a great acne laser.
I need all of
Um,
Me
these.
too.
know.
there's
Can you just put us all
now
next to each other? Like,
How many can you get in one day? We're
like
gonna
just
be red like Satan.
two hands next to each other. You could just do two of us at the same time.
I mean, I've done IPL and then followed with an erbium. So I've done that. I've done CO2 followed with an erbium, but you know, there's definitely things you can do together. Um, I would also say there's a lot of other stuff, and we'll just call this like the radio frequency tightening. Most of those are not very good because the radio frequency, the idea is it's supposed to deliver the energy underneath the skin to tighten it essentially and stimulate the fibroblasts to form more collagen. The issue is in order to get it hot enough to stimulate the fibroblasts, you'd actually end up burning the skin. So you can't do that, obviously, and that's why those treatments are ineffective. Now, one company that has a device that is pretty interesting because it kind of bypasses it a little bit is the Morpheus 8. So that's basically microneedling, and the tips of the microneedling are actually radio frequency emitters. So you're microneedling and delivering the radio frequency below the skin. So it's actually quite a nice combination. And microneedling is actually a good thing to undergo. It works pretty well. But just some of the topical stuff. I mean, honestly, if it doesn't make you peel, it's not
It
going to
doesn't
do it.
work.
Doesn't work.
Wow. And there's all these women spending thousands and thousands of dollars a month on creams and just lathering it up. And
Yeah, I mean, honestly, the creams they're fine, but you know,
What's your favorite one?
sunblock. I mean, seriously, like that's the best thing you can do is protect your skin from the sun. That honestly, that's now there are nice things out there. There's many of the creams have hyaluronic acid in it. They have hydroquinone, which is like kind of a brightening, lightening agent, and those work pretty well. Salicylic acid will cleanse the skin as well, get rid of a lot of those oils. So, do I have a favorite? No, but there's a lot of good stuff out there, but it doesn't replace sunblock. Right? It really doesn't.
All right, Matt, we want to do some rapid fire. Can you rate
Let's
these
do it.
1
do
to
it.
10 being the best? 10 being the best. All right, salmon sperm facials. That was requested by Stacy.
of course it was.
That's a -2.
Oh!
She's going to be so sad.
So sad.
She spent so much money on that.
I mean, so I've seen. Okay, so using like essentially you're basically it's DNA that they're trying to do in there. It's
Are you just saying we could use our husband's sperm instead of paying someone for salmon sperm? Would that do the same?
Jordyn, you have to see your husband's sperm to actually use it.
since I am friends with your husband, I'm going to say yes.
He'll appreciate that, Matt.
We're calling him right now, Jordyn. We figured out a way to wake her up, Scott.
You'll just put it into like, here's a cup.
Here's a cup.
She doesn't need the pellet to wake her up.
Yeah.
She just needs the facial.
Facial.
The salmon. I've seen it. Look, I've seen it done with like when they do it at the same time as a microneedling. Maybe there's some benefit, but honestly, there have been absolutely zero, and I mean zero studies, real legitimate studies that have shown any benefit whatsoever to salmon sperm.
Thank you for clearing that up.
Thank you. Microneedling.
Sorry, microneedling's great. I'll give that's a 7.
Okay. CO2 laser, which you just.
10, 100%. Yeah.
That's a big one. Red light
Oh, I
therapy
wanted to ask him
masks.
about that.
Yeah, so red light therapy, I'm going to give it a 6. I'll tell you, I'll tell you why. The benefits of it are somewhat understated. It can be very helpful for collagen, hair regrowth, getting rid of inflammation in the skin, and even though the effects are mild, it's such an easy thing to do, and it's harmless. I mean, there's no downside to doing it. So I'm going to go ahead and I'd even say maybe a 7. I mean, it's pretty good just because there's really no downside to it.
Okay, and I have a question. Do you need to buy the most expensive one, or can you just buy the one on Amazon? Like, is all red light, red light?
Yes and no. So it's not about expensive, it's about power. I actually have a real red light device, not the face mask, but the full lamp. And that is powerful. And it is something that you have to wear goggles for or it'll burn your retinas. So that in theory is going to work better, but essentially anything that's going to give you the most power, and please wear eye protection if you're getting something powerful. That's what matters. Price is irrelevant. It's about power. So look at the wattage.
Yes. Okay. Ice rolling.
Yeah, it's a 4. It helps a little.
Sculptra.
Sculptra's great. Love Sculptra. Okay, so Sculptra is a different kind of filler. Sculptra is what we call poly-L-lactic acid, and it's different than the other fillers, which are primarily hyaluronic acid. Sculptra is actually one of the oldest, I think the oldest filler, and its original purpose was to use in the 90s in HIV patients when we didn't have good treatment for HIV/AIDS, and there was a lot of fat wasting and muscle wasting in these patients. So they became very skeletal, very gaunt. And these were injections that were used to help build up their collagen. And, did a great job for that. And it's a great volumizer. And continues to be so to this day. The downside is the results are not immediate, and it's something that requires several treatments because they're cumulative over time. So that's the downside. But Sculptra is great. Give it like an 8. It's just the fact that you have to go through repeated treatments.
How many treatments do you think it needs to work?
It depends. I mean, if you're quite hollow, I mean, you're going to need 4, 5, 6, 7 treatments. If you're not, you could probably get done 2 or 3.
Okay, face taping and mouth taping. I've heard so many yes and so many no's.
Right. Okay. So the face taping, that's a no. That's a hard pass on that. Okay. The mouth taping, it depends. Mouth taping to help with snoring, it can be helpful to force you to breathe through your nose, which you're supposed to do. The only caveat I would say is if you're having nasal problems or don't have a really patent nasal airway and then you tape your mouth shut, that's a problem.
That's a little
Yeah.
scary.
So then you're just basically suffocating yourself and you're giving yourself sleep apnea. So just be careful with that.
Okay, Kybella.
Yeah, I'm not a huge fan. It does it's basically something called deoxycholic acid. It is really, it does dissolve fat, but the results are somewhat unpredictable. It's painful. And honestly, when you administer it, especially kind of like under the neck, I've seen a lot of people develop some pretty terrible scarring and like dimpling from those injections.
Pass.
Okay, pass. Blephs.
10 out of 10.
10 out of 10. I would say 20 out of 10.
Thanks.
Here's our model.
Thank you.
And then CPAP machines.
Yeah, so CPAPs are super important. And, even though I do sleep surgery to help people, improve and resolve their sleep apnea, it's still not a replacement for CPAP. CPAP, even we could make someone's upper airway anatomically perfect and they're still going to have sleep apnea sometimes. So CPAP is a great treatment to prolong someone's life, frankly.
Awesome.
Okay.
Well, Matt, Dr. Hershcovitch, thank you so much.
So much.
Thank you.
I couldn't wait to join the Pudding Pals.
We can't wait to have you join
The
us.
pudding doc. Yeah.
Pudding doc.
I mean, not many days go by where someone doesn't ask me how to find you so they can also get a Bleph. But can you tell everyone how they can find you?
Yes.
Sure. So I've 2 websites, facebydrh.com and socalbreathefree.com, and both are going to get you to where you need to be, and depending on what you're looking for. So whether it's cosmetic improvement or functional improvement.
Awesome. Well,
Thank you, Matt.
Matt,
You're
thank you
welcome.
so much.
You girls have a
You
wonderful
know we'll
day.
talk to you in about a hot second needing something. So we'll see you soon. Thank
We'll
you.
see you soon. Have a good one. Bye.
Well, that was a great episode.
That was amazing. He's the best.
That was so good, but what the fuck is that something?
Kybella.
Kybella. Where'd you hear that, on TikTok?
Ashley, when you're bigger and you have a double fucking chin, you'll know what Kybella looks to, okay? When you're trying to figure out how to get rid of every fat pocket on your body.
I was
You're
literally
crazy, you're
looking like,
gorgeous.
what is that?
Oh, you're
And why
crazy.
would someone face tape or mouth
I
tape?
think we should note for our pudding, Stacey Perlman, you got to stop with the salmon sperm. You just ask Evan. Just ask Evan. You're going to save you a lot of money from this episode.
Just rub it in, Stace. Rub it in.
Probably already does.
Probably.
All right, well, let's finish up and play our game.
All right,
Let's do it.
here we go. Who's gonna win?
5 fingers, guys. Never. I feel like I'm gonna.
Never
win.
ever Kyra Bella, whatever the fuck it's called.
Ashley and Mira like, Kyra, no.
Thank God I didn't Kyra. Okay. Never have I ever used a filter so strong. It basically did the surgery for me.
Oh, definitely.
Definitely
Yeah, I
back
mean,
in the
and
day.
friends do it on us, and we look like different people.
When
so.
I used to make myself skinnier, like the glass would like be like,
Oh,
yeah.
or like the wall is like.
Remember that time on my birthday I wouldn't repost the picture that someone posted of me?
Oh,
Yeah.
It didn't even look
it
like
didn't
you.
look like you.
Okay. Never have I told my doctor, just make me look like her. I definitely
I've
do
never
all the
done
time.
that. I've never done that.
Like, just make me look like J-Lo. Okay.
That-
Okay.
Here we go.
That's wild.
Never have I ever ripped off my acrylics and immediately regretted it. I feel attacked.
I've ripped them off, but I'm fine without them.
Well, once I like take them off, and I have to take all of them off.
Oh.
It's like, okay.
I haven't had them for a long
Me,
time.
it's been 30
Never
years.
have I walked out of a salon and pretended to love it while dying inside.
Oh, like your hair or something?
Yeah.
Oh, definitely me.
I mean, maybe at some
Okay.
point.
Never have I ever done a detox, but that was basically just starvation and coffee. Yeah, me, duh. All right, I lost.
well,
Okay.
That
Wow.
was easy. That was quick.
so what are you going to do?
Shit. You want
are you
to
gonna-
take spill the
Dare to
pudding
dip?
or dare to dip?
I'll spill the pudding.
Okay.
I'll spill the pudding.
Oh, God, it's such a good thing you lost. Ashley and I are pretty boring. Name all your cosmetic procedures you've had and done.
Anything to look like J-Lo?
Can you make me look like okay, well, I've done a breast reconstruction and lift twice.
I didn't know twice.
The first one was messed up. The second one, they're great.
Okay.
I've done a rhinoplasty. I did not have a deviated septum. I just didn't like my bump.
Your nose is beautiful now.
I did veneers, but not by choice. I was knocked over by a dog and cracked all my teeth on a rock. These are now fake, or as my husband says, I have wood teeth. And that's it, I think. And some Botox and filler, but not at the moment. So
Well, you are beautiful.
I'm waiting for my mommy makeover.
You're looking great.
You're
And nip
looking
and tuck
great.
in us.
Nip and
Suck
tuck
it
in
up.
us.
If I can look like this in the mirror with my hands up, I'd be happy.
She actually tells me if I'm going to do it, wrap me up like a mummy and see me in 2 months. Like, that's how much
I want
recovery
everything.
I want.
Everything done.
Everything
You're gorgeous. So, but there's going to come a time in all our lives we're going to need a little more work.
We'll be at Matt's store.
Call Dr. Matt. That mini facelift is coming soon for me. Well, girls, this was so much fun. Dee, thanks for keeping it real, because
I'm always real.
that's why we have this Pudding Pals podcast. We hope everyone enjoyed today's episode. If any of Dr. Matt's services interest you, reach out to Dr. Matt Hershcovitch. And be sure to like and subscribe to the Pudding Pals podcast, and we will see you next time.
Bye.
Bye.